Hi everybody, I'm Al Rochelle. Continuing our discussions here as you're watching on your website right now. We are talking about POTS, specifically the controversies about exercise. And joining me right now is Dr. Chi Fu, who is an expert on exercise, but not just exercise, doctor, the kind of exercise to do. So give me a little bit of your background.
So I was trained as a physician, neurologist, and practiced medicine for 8 years in China. Then I was very interested in clinical research, and then I started to spend another 4 years, get a PhD degree in autonomic neuroscience. After that, I finished my postdoc training in autonomic circulatory arrest or cardiovascular control with Dr. Benjamin Levine in Dallas, Texas.
Yeah.
And after that, I became faculty working at UT Southwestern Medical Center and also the Institute for Exercise and Environmental Medicine.
Now, what's interesting about you and what I've got on here, besides you have great credentials, is the fact that you were involved early on in this very, very important study that said that exercise can help rehabilitate people who may be suffering from POTS.
Yes, I was honored and lucky to be involved, and that was 15 years ago when I was just a junior faculty member, and we decided to do a study which was supported by the National Institute of Health to use exercise training as a medication, non-drug medication for patients with POTS. So the idea came from Dr. Benjamin Levine's spaceflight research, because he has a long-term interest in spaceflight, and he and his other researchers working with him, they found astronauts, when they return from space, and they all have orthostatic intolerance or POTS-like syndrome.
That's true, that's true.
And then they decide, especially in women astronauts.
Right,
So they developed an exercise program and allowed those astronauts to exercise in space, and when they came back, and they show improved orthostatic intolerance condition. So the training program, again, was based on spaceflight research.
Yeah, and I know Nicole Stott, who was one of the astronauts from the Tampa Bay area, and she, when I had interviewed her several years ago, she talked about how important exercise was. Now, in terms of this, using it with people that have POTS, intuitively you say to yourself, these are some people whose symptoms are, they're fatigued, they're very tired. So how all of a sudden did it get flipped and it said, well, if you're fatigued and you're tired, the answer is exercise?
That's a great question. I think many times everybody knows exercise is good. Everybody should do exercise. And some of the physicians, after they see these patients, they would also recommend patients to exercise. The question is how you do it. So I think because these patients, even without doing anything, just or walking around, will become very fatigued. So if you ask them to exercise, that made them even more fatigued.
Yeah.
So the key point is that in the very initial stage of exercise, you have to make sure they are doing horizontal exercise. So without upright stress, also static stress. So these patients, many times, they are fine when they are sitting around or laying down, but they have more clear clinical symptoms when they are stand up or in the upright posture. That's because gravity pulls blood from the heart, central part of the body, to the lower body, and the heart has to work harder in order to maintain their blood pressure.
So then what kind of exercises are they doing?
We recommend horizontal exercise, for instance, rowing.
Okay, rowing. Okay, I'm trying to think about horizontal.
Good.
Okay, yeah.
Right, or recumbent bike or swimming.
Oh, okay.
And those kind of exercise, and you have to start at low intensity and gradually increase the intensity and also the duration. You cannot ask them to start with high intensity and an hour training. That will not work. So you have to make sure they start at the very low intensity and start with 15, 20 minutes in the beginning, then gradually increase the frequency and the duration, and then gradually add upright exercise to the training package.
Right. It's not like New Year's Eve when you make a resolution, I'm now going to run 8 miles a day, and you get out there and you try to do it. So then the question then becomes, fine, they exercise anecdotally, you've seen people improve. Is there science to back up that exercise really can help mediate in these situations?
Yes, there are a lot of researcher studies published so far, including spaceflight-related research and also research in patients with POTS. Just to give you an example, 10 years ago, 15 years ago now, we did a study, as I mentioned, that we measured these patients' physical fitness level by measure VO2 oxygen uptake while they're doing exercise or walking on the treadmill or sitting on the bike doing exercise. We actually measured all these numbers, and we also measured their heart size, their blood volume, their heart function, brain function, all these things. And we have data to back up. And we found that before training, these patients have reduced VO2 peak, just peak oxygen uptake, which is an indication of physical fitness.
Yeah.
And way low below the sedentary people, age matched.
Oh, okay.
And also these women, when you look at their heart with MRI, and you can see their heart is much smaller compared with healthy but sedentary people. And also they have their reduced blood volume. And all these things can be seen in astronauts after return from space.
Yeah.
And after training, we did the 3 months exercise training, progressively increased intensity and duration. And we found that after training, 70% of the patients no longer met the criteria for POTS. And their heart size increased significantly, and blood volume was also increased. And more importantly, their peak oxygen uptake was also increased significantly.
Now, when you say exercise, so does this need to be tailored by age and by each individual person?
That's a great question. That is right. So we use age, the common way we use, if it's in the clinical setting or research, not in the research setting, in the community setting, we just always tell patients 220 minus your age is your supposed peak exercise heart rate. And then we use 70%, 65 to 70% of that peak heart rate as a guidance for patient to exercise, to reach that goal.
Now, is there a possibility that exercise can exacerbate a situation, though, and make it worse?
In the beginning, it probably will make patient feel worse because they will be exhausted, they will be tired, and they will feel muscle sore and painful. But gradually, that exercise will make them feel much better.
Now, one thing about exercise, too, is it does require discipline, and discipline might be one of those mind-body things that you have to go through if you figure out, I need to be able to conquer this, and so I'm going to have to discipline myself to exercise. But if you discipline yourselves in exercise, it leads to discipline in many other areas, too, doesn't it?
Yes, I think that's exactly right. I think in the beginning, for sedentary or even patient population to exercise, it's very difficult. So it has to be done with physician's supervision or personal trainers' help. And then gradually, after a period of time, they can develop that habit. Right. And then hopefully become part of their life. Yeah. Just they need to wash their face every day, they need to brush their teeth. Hopefully exercise can become part of their lifestyle.
Right, exercise is survival, folks. It's not just, just the luxury. Just two quick things, and what advice would you give to doctors that might be listening to this program right now in terms of what they need to know about exercise? I
would say doctors, for sure, exercise is probably one of the best medicines you should recommend to your patient, but the way how they exercise needs to be carefully thought through, because you have to make sure they start training with horizontal position and not upright. Try to remove the impact of gravity. And then, for instance, again, rowing is one of the best exercise mode. And also you need to monitor closely how patients feel and adjust the program as needed.
Right, and one word of encouragement to patients if you've got one. What would you say to patients?
Or say, hang in there, it will make you eventually feel much better. I understand the initial 1 month will be very difficult, but if you could overcome the first month, you will see significant difference in the second or third month of training.
Doctor, that's great. Thank you for your time. We really appreciate it.
Thank you so much for the opportunity.